right, we'll get started. Thanks everyone for joining us. I'm Ryan Spiteri, the Communications Manager here at the Brant County Health Unit. Here with me I have Dr. Malcolm Locke, Acting Medical Officer of Health at BCHU, and Dr. Ann Tober, BCHU CEO. Before we get started, can we do a quick roll call for those joining us? I'll just have you state your name and your affiliation.
Patty Shelby, Rogers Delta.
Go ahead, Patty.
It's Patty from Rogers TV.
Michelle Ruby from the Expositor.
Thank you. Good to know I'm not talking to myself here. In a moment, I'll turn it over to Dr. Locke to make a brief statement. This will be followed by a question and answer period where questions regarding COVID-19 case trends, case and contact management, etc., can be directed at Dr. Locke, and questions regarding the local vaccine rollout or vaccines in general can be directed at Joanne. At this point, if you could put your phone on mute if you're able to, we'd appreciate it, and I'll now turn it over to Dr. Locke.
Thank you all for joining us. I'd like to start by sending my condolences to the family and loved ones of the individuals we lost to COVID-19 last week. Last week, there were 63 cases of COVID-19 locally. We are continuing to see a rise in cases in line with what we're being seen provincially. As school begins today for many, I'd like to remind all students and their guardians that it remains more critical than ever to ensure the school self-screening tool is being used every day before students attend in-person classes. For those that do not pass the screening, it is imperative that they do not report to in-person class until they have followed the direction outlined. We need all residents to play their part to ensure students can enjoy some semblance of normalcy. I know we are all craving some normalcy, but we need to continue to follow appropriate guidance, including event or location-specific guidance. Last week, the province announced the implementation of a proof of vaccine program for select settings. As of September 22nd, Ontarians will need to be fully vaccinated and provide their proof of vaccination along with photo ID to access certain public settings and facilities. This approach focuses on higher risk indoor public settings where face coverings cannot always be worn. The full list of settings can be viewed on the province's website. The Brant County Health Unit fully supports this decision. Evidence from other jurisdictions has shown that similar policies have been effective in boosting vaccination coverage rates and in turn making things safer for everyone. We are already beginning to see the effects of this locally as 842 first doses have been administered in Brant from September 1st to the 5th since this announcement was made, which is well up on the daily averages we were seeing previously. As of Sunday, 78% of Brant residents 12 years of age and older have received at least one dose of COVID-19 vaccine, and 72% have completed the series. We continue to see a large proportion of cases amongst those that are unvaccinated. Since June 19, nearly 86% of cases are in those who were not fully vaccinated. This aside, COVID-19 vaccines are incredibly effective at preventing severe outcomes. This is what the current vaccines were designed to do. The Ontario Science Table's data shows remarkable differences in the number of patients hospitalized and in ICU provincially between those vaccinated and unvaccinated. All of the data we continue to receive tells us the same thing. Vaccines are effective and are our best tool in our fight against COVID-19 and the Delta variant.
Thank you, Dr. Locke. We'll now open things up for questions.
Michelle from the Expositor. Just following up on something that Dr. Locke mentioned about the passport program and how it's had an impact on the number of people who are getting vaccines. I was reading that overall across the province, there's been a doubling of appointments since the passport program was announced. Is it similar in Brant? Have you seen like a dramatic increase in the number of people who are deciding now to get their first shot?
Yes, hi, Michelle. Yes, we're experiencing the same thing. We've certainly had an uptick in the number of vaccinations that we've been delivering, especially in our pop-up clinics, etc. So the short answer is yes, we're seeing the same increase in numbers here.
Okay. Do you know, on average, prior to the announcement, the passport program announcement, on average, how many vaccines had you been giving over the last few weeks?
I'll pass it over to Joanne.
Thanks, Michelle. So we have seen an increase that we were doing probably about 150 to 200 immunizations a day, and that is doubled. And we were seeing initially it was about 20% that we were seeing as first doses, and that has been creeping up. And now it has been about 50% of the number of people we're seeing are for first doses. So that's great news.
Right. And I know now that I've asked this before, but you've got the pop-up clinics. Are there other strategies that you're planning to get these last people, few people to come up and get their vaccines?
Yes, we have the GoVax bus in town a couple of days ago to help with our promotion and to help immunize people. So that was another strategy we employed.
Sorry, Joanne, what's that? The GoVax bus?
The vaccine bus, the Go bus that is around doing vaccines. So that was in our community on Sunday.
Oh, okay.
A number of vaccines. So we may get that bus back. It's highly in demand. So that was one strategy that we employed. We have gone to workplaces. The mall continues to be a very active place for us. So we've extended our time that we're going to be at the mall to facilitate shoppers getting their vaccines. We are going to be providing immunizations at schools coming up. So we have been to workplaces. So any opportunity that we have, we're seizing to help vaccinate people.
Will vaccines be offered to students in all schools?
At this point, no, we won't be in all schools. There are schools that wouldn't have children that would be eligible, and we are working with school boards on scheduling and to make arrangements for those school clinics.
Okay. Thank you.
It's Patty from Rogers. I have a question in regards to schools. For those staff members that are not vaccinated and are going to be doing testing, do you know where the tests came from? And is this a Government of Ontario initiative, or is this managed through the health unit?
We've had discussions with the Board of Education, etc., and I don't specifically know where the tests are coming from, but I have heard anecdotally and read in the media that some school boards are purchasing these testing sets themselves and have taken on that responsibility themselves. So I can't be absolutely sure this is a provincial initiative, but certainly some school boards have already decided that they will proceed with that initiative themselves.
Now, in terms of kids and sports, I know that we were waiting for direction from the province and if school sports can return and what that would look like. What are your thoughts on it returning with children that are vaccinated or at the very least tested to ensure safety in these environments?
Well, I think we're still, as a health unit, I think we would still be somewhat selective about particularly contact sports And it depends on the type of sporting activity and whether it's indoors or outdoors. There are quite a few variables to consider when we think of disease transmission. So I'm not absolutely sure that we've landed on anything provincially. We still haven't heard anything from the province or guidelines from the province. Now, maybe the Board of Education and the Ministry of Education have released some suggestions, but I'm not aware of them, and they haven't reached. They certainly haven't reached me and the health units to this point. So I think it's still being considered and negotiated.